Now we're talking to Carmel Doyle, who is involved in a Trinity College Dublin study on children with an intellectual disability, and it's a very interesting study. Firstly, you're very welcome to Disability Matters.
Thank you, John. I'm delighted to be back on.
It's our pleasure to talk to you. You might remind us about how you ended up getting involved in the study.
Yeah, well, so John, I suppose as you mentioned there, my role, so I'm an associate professor in the School of Nursing and Midwifery in Trinity College, and my role involves the education of intellectual disability nursing students and other students who have an interest in intellectual disabilities. And as part of that, all of our practice must be evidence-based,
Yeah.
and therefore I actively engage in research. And my field, my background is I'm an intellectual disability nurse, but I'm also a children's nurse. So much of my work in terms of research is with families and children who have a disability. So that's kind of my area of interest and how I engage in those types of projects.
Very good. And do you know where the study came from? Who decided to do it in the first place?
Yeah, so we have several studies ongoing at the same time. So the one that I'm going to talk to you about today is one that was funded by the National Disability Authority last year, and it's like the front end of a larger project, okay? So it's what we call a desktop research project where um we go out and we scope the literature on a particular topic, and the topic was obviously given to us by the National Disability Authority, and they funded the project. And basically, it's around behaviours that challenge, and there are many children and young adults who have behaviours that challenge, and we don't often know why that is. So I guess what we wanted to establish was what are the factors that actually lead to those behaviours that challenge, and also how we might prevent and manage them in terms of crisis. And often some of those behaviours that challenge lead to family crisis. So that was kind of the impetus, I suppose, for this particular project.
Now,
So
sorry,
yeah.
go ahead.
No, so in terms of the project, I suppose we call this a scoping review, which means we look at all of the published work that's out there that we can actually retrieve, and we cast the net quite wide in order to gather it all. And then by having that information, it really helps then when you go to plan a face-to-face research project with the children and the families. So it's good to have a baseline to start with. And that's why these kind of pieces of work are important. So would you like to know a little bit about the findings?
Why not? Maybe at the
Yeah.
end. Maybe at the end. I
Okay.
tell you what I'll
Yeah.
do.
Yeah.
I'll ask at the end, would you like to say anything else? And you might put the findings in there, if that's all right with you.
Perfect. Yeah.
Because for
Great.
relevance, for somebody listening, they'd like to hear about what the study is, what it
Yeah.
goes into, and then
Yeah.
findings.
Yeah. Perfect.
Um, and you say it's a study, I know it's a study, sorry, it's a study of children with intellectual disabilities, where
Mhm.
families involved in any way.
Yeah, so I mean, families are the crux of everything that we do with children. And obviously, if there's something awry with a child, it always impacts family functioning and how the family manage that particular difficulty that they might have. And we must remember that the majority of children obviously live naturally at home with family. So therefore, families are always involved when we scope out literature or engage in research. They're really important parts of the projects.
Very good. So what's the date range?
Yeah, so what we did was we scoped the literature and we actually only spanned the last 10 years. And you might say, well, that's a short period of time, or some might say it's a long period of time. I guess the important thing is that you get currency and up-to-date literature. So we scoped the last 10 years up to 2025, up to, sorry, the end of 2024, and that informed then the findings of the
Right.
project.
And did you see a lot of difference between when you started and the information you started
Mm.
to get against what you find now?
Yeah, well, I think one of the things when you're tasked with a project like this is, you start out and you think you know some of the answers and you almost have an ability to preempt what the findings are. But in actual fact, these types of projects are really helpful because you have to put those aside and you actually just look at the literature. So what we did find, I guess, was that there's a huge amount of literature published in the last 10 years. Now, we were specifically looking at children who have autism and intellectual disabilities, children and young adults, I should say. And because there's been a lot of talk about autism and there's an increased recognition around diagnosis of autism and intellectual disability, there's more published work on it.
Right.
So there was lots of material out there for us to look at.
Very good. And what's the age range for the children?
Yeah, so children for this particular project could be anybody from the age of 0 up to, and we included young
Okay.
adults, so we included up to the age of 24. And the reason we did that was because um, nationally we're finding that actually adolescents heading towards young adulthood often have difficulties around their behaviours, and that leads to the difficulty then with the family breakdown and possible crisis situations. So that's why we spread the scope quite wide in terms of the age.
Well, remembering back to my own adolescence, we all
Mm,
had problems with
mm,
parents. We all had hormones and it affected our relationships with parents and that. Is it
yeah.
similar or worse?
Well, it's different. I mean,
Okay.
I would say there's similar issues that come up, but we must remember that if you have autism or intellectual disability, you have the added difficulties possibly around communication
Right.
and self-regulation, and that can be, a big issue for children. And you've also a lot of changes actually that occur in adolescence that we might find difficult to adapt to anyhow. But if you have the addition of an autism diagnosis or you have an intellectual disability, then your understanding might be different also. So therefore, it can lead to stress, and a lot of stress. And often the way we display stress, instead of maybe vocalizing it, is to display a behavior that challenges.
Right. And if we look at the causes of intellectual disabilities, because I'd say there are many.
Oh, look, there are many causes of intellectual disability in children. And I suppose the important thing to note is that some children are born with a health condition that disables or they have an impairment. And yet there are some children who experience it actually as a result of illness post birth, or they might sustain injuries, or they might have very poor nutrition, or so on and so forth. And children with disabilities can include children who might have cerebral palsy or spina bifida. They might have a syndrome, and one of the most common syndromes that we're all familiar with would be Down syndrome, or the child might have a hearing, visual, or physical impairment and an intellectual impairment. And many of the children actually have a single impairment, which means they have one challenge. And yet there are many that actually have multiple impairments. So you could have a child born today with cerebral palsy who might have mobility issues, they might have difficulty communicating, and they might also have a cognitive or what we call an intellectual disability. And that interaction between the health condition and the impairment and the personal factors and the environment that that child lives within and is supported within makes it very complex, but it also means that every child's experience of disability is actually different based on their surroundings.
Yeah. Last time you were here and last time you spoke to us, you spoke about the need for sorry, you get it now, an assessment of need. And you
Yeah,
said that was 3 years waiting for that.
yeah,
Has that
yeah.
increased or decreased or? Is it similar?
Um, I guess, John, yeah, I mean, I did speak to that, and that's in some areas. Some areas have a decreased waiting list, but some areas have a much longer waiting list. And I suppose to just give people an insight, an assessment of need is an assessment that's undertaken to determine the health or the educational needs or services that a child might actually have. And under the Disability Act, that is the right of the child. And we have a system in place where we have the Progressing Disability Services agenda, and that's where your assessment of needs is kind of umbrellaed under that structure. And that's really important. And you might say, well, why is it so important? Well, we know that early intervention produces better outcomes for the child. So if you have had an assessment of need, the likelihood is you're going to have a multidisciplinary input into the life of that child, whether it's around dealing with physical difficulties, whether it's around education or health needs. And if you haven't had the assessment of need, then you don't get the intervention in a timely fashion.
Right.
So the ideal is obviously that that assessment of need happens within that first 3 to 6 months post submission of your documentation. But sadly, that isn't always the case. And currently in Ireland, there are significant waiting periods for an assessment of need. And that's something that the Ombudsman for Children has spoken a lot about in recent times and has published some findings around that. And they have really tasked the government and the Disability Office with actually resolving some of those issues. And I guess that difficulty in accessing the assessment of need and then the intervention after that is largely due to staff shortages
Yeah.
within the HSC or the provider that's doing the assessment. And if you have staff shortages, then the list builds.
Of
Um,
course.
and then we also have an increased awareness. I think, people are much more aware now of maybe the normal milestones for a child, the normal developmental milestones, and therefore we speak out a little bit more. So we're presenting, families are likely to present saying, look, I think there's something challenging my child and I want this assessment.
Yeah.
So which is a good thing. That
Of
is a good thing.
course. Yeah.
Yeah.
And tell me this then, does a child who has had this assessment of need and had the intervention subsequently have a
Mhm.
better chance of a better outcome?
Oh, look, absolutely. I mean, it goes without doubt that a child who has had specialist intervention is likely to have better outcomes. Now, we must remember that you can't reverse disabilities. So, what we try to do is to support and adapt to those disabilities and try and intervene and prevent maybe further disabilities as a result of the initial one. So, normally, when what would happen is these children would access what's called a Children's Disability Network team. And that team is a multidisciplinary team and they address the needs of children across physical or sensory or intellectual needs. And it's an interdisciplinary team model. So there's an integrated plan of care, and it isn't just looking at the health needs of the child, it's also looking at the educational needs. And, for a child, for instance, who presents to a Children's Disability Network team at the age of 3, they're about to start preschool. So that intervention at that point is actually really crucial for the outcomes for that child.
I wanted to ask you around early age feeding. Did you note anything around that?
Yeah, so actually one of the findings that from the research study that I mentioned earlier on was that often children with intellectual disability or autism have difficulties around feeding. And that in itself, if they've got a sensory difficulty and they don't like the color of the food or the texture of the food, that can make meal times actually a very stressful period of time for them. And actually, in order to get out of feeding and what often happens is they exhibit a behavior that maybe we don't like. So they may start to self-injure or hit out at those around them. So it's really important actually that we consider feeding when we look at these kind of issues. There are also, aside from that particular study, there's somebody looking actually at the types of feed for those who can't feed orally. So for those who have to be fed through an enteral feeding tube, instead of buying a product that you can put through that tube, she is actually exploring how we might use ordinary food that's blended using a particular type of blender, and actually how that might have positive outcomes for a child also. So that's like an ongoing piece of research. So there are lots of different feeding issues for people with disabilities.
But that might improve over time.
Absolutely,
Yeah,
yeah. And again, it comes back to intervention. And if you get a good assessment, then the likelihood is there would be an appropriate intervention
yeah,
put in place for that person. Yeah,
very good. Yeah,
yeah,
and positive outcomes, we love them.
yeah.
I want to ask you then about not milestones, first milestones like walking, talking. Are they hitting like a so-called normal child?
Yeah, so I guess milestones are something that I talk a lot about in my research, because actually if a child or an infant doesn't meet their milestones, that's what we call the first red flag
Hmm.
for investigation. And that's well before an assessment of need. When we're going for an assessment of need, we already usually know that there is something some kind of a developmental milestone not met. So often the developmental milestones in the first year are really crucial. And remember that a public health nurse sees a child at 9 months, an infant at 9 months, and does an assessment. And in that assessment, they look at things like the gross motor skills of an infant. Are they sitting up? Are they able to roll? Are they sitting up unaided without somebody propping them? And they also assess things like the fine motor skill. So they assess how they grasp things, so what we call the pincer grasp. But they also assess things around communication. Is the child laughing? Can they be soothed by their parent? Have they got any vocalization? So are they saying mama or dada or any of that? So when those milestones are not being met, and I say that they're often picked up at the 9 month checkup with the public health nurse. Often it's much later when a parent actually says to possibly a GP, they'll say, do you know, there's just something not right with my child. And that instinct is so important. And that indicates that further investigation is warranted. So we have what we call red flag signs, and a red flag sign is when a health professional has a report by a parent, or they witness or observe that a child isn't meeting some of those milestones. So if, for instance, at 9 months, a baby can't sit unsupported, or they're not able to pick up an object, um, then they're what we call red flag signs. Okay. And obviously that's at 9 months, but there are later red flag signs. It might be preschool before a toddler is flagged. And that might be simply something around lack of socialization, that they're not able to mix or participate with other children. They might be unable to follow very simple demands, or they're not able to maybe start toileting or hand washing on their own, or things like that. So there are different things that we call red flag signs, and professionals know what these are. And often what parents know is that something isn't
Yeah,
just quite right.
they're the first point of contact, aren't they?
Yeah,
Yeah,
absolutely. Yeah.
yeah, yeah,
Yeah.
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 And if we move on a little, what about things like creches and Montessori's?
Yeah, well, interestingly, I suppose the so now we have what we call that early childhood scheme. So children, from 2.5 can go to preschool, and that service is provided by the state. And in that, what we have for children who have additional needs or are flagged as possibly having red flags, there is what we call the AIM program. And the AIM program is an access and inclusion model, and it's designed to support the inclusion of children with disabilities in early childhood and education settings. And that's actually really important, that there's recognition that children with disabilities have additional needs. And what that might mean is that there might maybe additional staff for that particular child, but also that there's an early intervention or an adapted or a reasonable adjustment is made for that particular child. And what we've noticed over the last 10 years is the numbers actually accessing that AIMS model of care has actually risen quite a bit. And that's largely because we know more now about children with disability, but also the numbers of children with disability who have been diagnosed has increased because of that knowledge. So if I know, John, you're probably familiar with the National Ability Support System
Yeah.
database, and that has some really important data for us. So in 2022, while there was almost 74,000 people registered on that database, actually almost 60% were under the age of 18. So there was 45,000, in or around 45,000 were children. Now, since that, we expect that that number has increased, but unfortunately, there was a delay in the rollout of the CDNT's data management system. So they haven't been able to upload the detail on children that are accessing multidisciplinary teams and not just respite. So therefore, we don't actually have numbers, more recent numbers. So our last accurate data would have been around the 45,000. So we know that actually we have children seeking and accessing services around the country. And they're likely, because of our population increase, they're likely to rise also over the coming years, which places a demand on services. And you can see then how that impacts the assessment of need.
What about children with intellectual disability forming relationships? And I'm talking about friends,
Mm,
neighbors, etc.
mm, mm. Well, I guess, I mean, John, I think everybody wants their child to have
Yeah,
friends, and
absolutely.
that's a very natural occurrence. I suppose in recent times we have the advent of more children with disability attend mainstream education than specialist education. And there's lots of reasons why people would attend a special school versus a mainstream school, but certainly the model of education for children is very much an inclusive model. So therefore, with the AIMS program at preschool level, that transfers then into mainstream school. So I guess children now with disabilities, if they attend mainstream school, they're growing up with their peers, and their peers may not have a disability, but because they're interacting and they're included with them, then there's much more opportunity for friendships to build and relationships to build. And that's a good thing for society, because it's really important in the community that these individuals are included. So I think, we certainly have moved on, and there is certainly much more inclusive, even activities outside of school, that allow people with children with disability to engage as well.
And then how did the children cope with school, mainstream school, and relationships there? Because
Yeah.
mainstream school tends to be some of the children in your neighborhood and some children from other neighborhoods.
Mm, mm. Yeah, and that's a good question. I think some children thrive much better than others, and often that can be down to where they live, if they have to travel to get to the school. And the ideal is obviously if that child is attending a school that's in their local area, because then they become known even outside of school in that local area. So I think many of the children do very well in terms of friendship, and some less so. And if you have a child who has an intellectual disability and engages in behaviors that challenge, that can actually put people off and that can put friends off. So that's something we have to really, I suppose, manage expectations and get a handle on. I think nowadays the education system between teachers and special needs assistants, they are very good at managing that within the classroom setting. So I think that there's more opportunity to harness positive friendships for children with intellectual disabilities than there
Yeah.
may have been in the past. Yeah.
I think most of what you said there goes for children in general.
Yeah.
There
Yeah.
are children who try to challenge behavior,
Mm,
exhibit challenging behavior,
mm,
and they have
mm,
less friends
mm,
in general.
mm.
So,
Yeah, and I think, John, it's important that we recognize that every behavior is a communication. And it's the onus is on us as adults to recognize what that behavior communicates for that child.
yeah,
So there's certainly lots we can do to support children in education. Yeah.
yeah, absolutely. Now, before we get on to the findings,
Mhm.
is there an end game? Is there a time when the study stops?
Yeah, so this particular so this part of the study is actually complete, and has gone back to the National Disability Authority and has been published in a report on their website. And that forms now, the NDA are actually undertaking a study at the moment based on our findings. So they're currently gone out to they had a questionnaire for parents and families to engage with, and they went out to the multidisciplinary teams with their questionnaires more recently. So that they're hoping to have a report published by the end of this year on the whole area of crisis and what leads to crisis situations.
Brilliant. We're coming
Mm.
right to the end now, and this is your
Yeah.
chance to talk about the findings of the study.
Yeah, so and I'm always excited to talk about the findings. I suppose one of the tasks that we were asked to look at was what are factors that might be associated with behaviors that challenge, or what could be deemed to be a possible trigger. And some of those findings were around things like parental behavior and stress, and sometimes that can actually be a trigger for a child or young adult to engage in behaviors that challenge. But also mental health issues came out as a big flag for us in terms of a possible factor, but also things like poor sleep, when a child or young adult has poor social skills and therefore doesn't have positive friendships, then that can lead to crisis. And then there were other things like around communication and feeding and things like that. But we found that a lack of access to support service. So when behaviors that challenge are engaged in by children, that has a ripple effect on the rest of the family, brothers and sisters, but also the parents. And if families can't cope and don't have coping mechanisms in place, then there's evidence of distress. And that leads to what we call crisis. And a lack of support or a lack of recognition of those behaviours, or a lack of access to support services, or when families don't know how to navigate those support services, then that causes family breakdown and
Oh,
leads to crisis. And those crises tend to happen, John, out of hours, at weekends when access to services are extremely
yeah,
limited. And then that has a really negative impact on the family unit. And invariably, what families do when things like this happen at weekends and when they can no longer cope is they turn up at an emergency department and look for support through that environment. And that isn't always the best environment to look for. And when a family gets to crisis, what we found was that crisis, depending on what provisions are put in place for the family, can actually lead to the child or young adult being removed from the home and being placed in an emergency placement to give respite to both the child and the family. And that again isn't always the best outcome for the child. And we know that these crises as caused by behaviours are traumatic for both the child, but they're traumatic for the family. And while we have CAMS, so we have Child and Adolescent Mental Health Services, we also have the CAMS ID model, which is for those with intellectual disabilities. Often children fall between the cracks, and one model mightn't take the child with autism and the other mightn't take the child with ID. So we need to explore, I guess, our referral system into CAMS and CAMS ID. And they're a specialist service. But there's no particular, we don't have currently a particular model or framework that addresses children and young adults with disability and behaviours that challenge. So
Yeah.
that's something that will be explored in the NDA study in terms of the needs of those children and families.
Carmel, I really enjoyed speaking to you. I think it's a very interesting subject that we're talking about.
Mhm.
I really enjoy it. I also enjoy Eilish's piece on older children, because some
Yes.
adults are children also. I
Yeah.
really enjoyed it, and thanks so
Yeah.
much for talking to us on
Yeah.
disability matters.
Oh, well, look, thank you, John. My pleasure. I think it's important to note that all these children grow into adults, and therefore
Absolutely.
we have to take a lifespan approach when we're looking at research for
Yeah.
all of these individuals. Yeah. Thank
Right.
you.
Thanks, Miller.